morning, Mrs. Cross. It's Julie again, back after getting your medication for you. I've got your digoxin that you're supposed to take this morning, and as you know, I've already come in earlier and listened to your heart rate, and I know that it was in the parameters so that we could get your medication. So I just want to check your armband after I wash my hands here. And if you can just state your name and date of birth for me. Cross, make sure that coincides with your medication sheet, and it does. And do you have any allergies, Mrs. Cross? Oh, good. Okay. So I'm going to do my last check here on my medication, and I have digoxin 0.25 milligrams for you to give, like I said, through your gastrostomy tube. I did crush the medication in the medication room in the container that it comes in. So I'm just going to open that up and put that crushed medication into my medication cup. And then I want to put some warm water in there so that I can dissolve the medication. Keeping track of how much I'm using, it's about 20-30 milliliters of warm water that I'm putting in there. And I'm going to stir that up till it dissolves. And it doesn't dissolve very well here because our water doesn't get very warm, but usually that dissolves up pretty good. So I got the medication ready. I've done my 3 checks. My 3rd check I just did here in the room. And the other thing that I want to do is assess, Mrs. Cross, your gastrostomy tube and make sure that it's patent before we put anything in it, and that it's there's not any issues with that. Mrs. Cross has a feeding running, so I'm going to put that on hold. She does have her head of the bed elevated already because she's got the feeding, so I don't need to do that. The first thing I'm going to do is assess the tube itself. And I want to put some gloves on. Okay, and I'm going to check to make sure that the tube is in the, looks like it's in the proper place. And I also want to check residual to see if there's any gastric contents built up into the stomach area before I administer any medication. So this actual gastrostomy tube has a stop valve on it, also called Lopez valve, and right now it's off to this part, and it's on to the feeding because the feeding has been running in. So I've got the feeding on hold, and I'm going to turn off this stop valve to the feeding because I'm going to use this port to give the medication through. I'm going to open that up. Like I said, the first thing I want to do is assess for any residual. And I pull back, and there is a little bit. And I'm just going to pull back until I feel resistance. And then I'm going to just insert that back into the stomach. That's approximately 10 milliliters of residual in there. So I'm just going to give that right back to the patient. Put the cover back on that, and then I'm going to get, so the tube is patent, the residual is low, there's about 10 milliliters of gastric content that I removed, so I put that back, and now I'm going to administer the medication. Before I put the medication in, the other way that I check patency is by putting a little fluid into the tube, and whenever you're putting any medication or fluid through a gastrostomy tube, you're going to use an irrigation kit, which I have here. I've already opened it up, and I put warm water in there. We don't need sterile water because it's just going into the gastric area, which is not a sterile environment. So because I'm going to do that by gravity rather than pushing it in, I took out the plunger. So I did need the plunger to check for residual, but now I don't need that. So I'm going to take this cover off again. And I'm just going to put in about 30 milliliters of fluid. And right now I'm going to turn that stop valve to off. so it just doesn't run right in. I have control over it. So that's about 30 milliliters there, and I'm going to let that run in. I'm going to turn this around so you can see. Turn the valve off to this, to the feeding. Whoops, I got it kinked. So it'll run in. And it's just about in. I'm going to turn it off. Now I'm going to give the patient, whoops, give the patient the medication. Let that run in. And then I'm going to post flush. So I pre-flushed with about 20 or 30 milliliters, gave the medication in 20 or 30, and then did a post flush to make sure that it's all gone in. Let that run in. And when you're giving medications through the gastrostomy tube, you need to do one medication at a time. So if I had other meds to give, I would have had other med cups and had those mixed up separately. The post flush. Okay, that's gone in. You try not to give a lot of air in between, so if you can turn the stop valve on and off in between, then the patient's not getting a lot of air. And just in time for the feeding was on hold, and now it's beeping at me that it needs to be turned back on, because it's only, it'll beep after a couple of minutes that it needs to be restarted. So I'm going to restart the feeding because I'm all done administering the medication. Make sure that the off now is to the extra port and that the feeding can run through this way. Now, if you didn't have a feeding, if the patient just had the gastrostomy tube and the Lopez valve, you could just put your syringe in through here. So that would be another method that you could do that. You don't necessarily have to use that port. Okay, I'm going to take off my gloves. Now my side rail, make sure that the feeding is patent, which it is. Then I would wash my hands. Make sure the patient is comfortable, and then I would document on the paper MAR or probably on an electronic MAR. And this concludes giving medication through a gastrostomy tube.